Do you know the early signs of diabetes? This question is more important than you might think. Diabetes, a condition that affects millions worldwide, often creeps up unnoticed. Early detection can make a world of difference in managing this disease, and it all starts with being aware of the signs. Today, we're going to shed light on 5 early symptoms of diabetes that you should never ignore. We'll talk about inflamed or infected gums, dark spots on the neck, strange sensations in the feet, hearing or vision loss, and the tendency to take long naps. These signs might seem unrelated, but they all point towards one silent predator: diabetes. We'll also discuss natural and homemade ways to keep your blood sugar levels in check, with a special focus on weight loss. Stay with us as we delve into these signs so you can be proactive and vigilant about your health. The first early sign of diabetes can be found right in your mouth. Yes, you heard it right. We're talking about inflamed or infected gums, an unexpected yet common symptom of diabetes. But why does diabetes, a condition that primarily affects blood sugar levels, have such a profound impact on oral health? Let's delve into that. Diabetes is characterized by high levels of glucose in the blood. This excess glucose can also find its way into your saliva, creating a perfect environment for bacteria to thrive. These bacteria combine with food particles and other natural substances in your mouth to form a sticky film known as plaque. If not removed, the plaque hardens into tartar, leading to gum diseases like gingivitis and periodontitis. Inflamed gums are often the first sign of gingivitis. They may appear red, swollen, and bleed easily, especially while brushing or flossing. If left untreated, gingivitis can progress into periodontitis, a more severe gum disease that can cause gums to pull away from the teeth, forming pockets that become infected. In addition to these obvious signs, chronic dry mouth and persistent bad breath can also be indicators of gum disease. But here's the catch: gum diseases can make diabetes harder to control too. Infections cause blood sugar levels to rise, creating a vicious cycle that can be hard to break. So how can you recognize and address this problem? Regular dental checkups are crucial, as they can help identify signs of gum disease before it gets too serious. At home, maintaining good oral hygiene is essential. Brush twice a day, floss daily, and consider using an antimicrobial mouthwash. Controlling your blood sugar levels can also help prevent gum diseases. Remember, it's not just about a beautiful smile. Healthy gums are a crucial part of your overall well-being. So next time you brush your teeth, take a moment to check your gums. After all, they might be telling you more about your health than you think. Now, let's move to the second sign: dark spots on the neck. Skin changes are one of the often overlooked symptoms of diabetes. Specifically, you may notice dark, velvety patches in the folds of your skin, commonly around your neck. This condition is known as acanthosis nigricans, and it can be a warning sign of prediabetes or type 2 diabetes. These spots appear due to an increase in insulin in your blood. When your body isn't using insulin effectively, the levels of this hormone rise. High levels of insulin can trigger the skin cells to reproduce at an abnormal rate, leading to the formation of dark patches. It's important to note that dark spots on the neck are not exclusive to diabetes. They can also be associated with other health conditions, such as polycystic ovary syndrome or Addison's disease. However, if you notice these changes along with other symptoms we're discussing in this video, it's crucial to seek medical advice. Now, you may wonder, why the neck? Well, the neck, along with other body folds like the armpits or groin, has a higher number of insulin receptors. This makes these areas more susceptible to changes caused by increased insulin levels. Acanthosis nigricans is not harmful or contagious, but it can affect your self-esteem and confidence. More importantly, it's a signal that your body isn't processing sugar effectively, putting you at risk for developing diabetes if it's not managed. If you notice such changes in your skin, don't panic. The first step is to get a proper medical examination. If it's linked to prediabetes or diabetes, lifestyle changes such as a balanced diet and regular exercise can help control your blood sugar levels and reduce the appearance of these dark spots. Remember, our bodies have their unique ways of communicating with us. It might not always be through discomfort or pain. Sometimes it's through subtle changes like these dark patches, so it's essential to pay attention to your body, no matter how insignificant a change may seem. Remember, not all skin changes are benign. Pay attention to your body. Ever felt odd sensations in your feet? This could be a warning sign. One of the hallmarks of diabetes, often overlooked, is strange sensations in the feet. This is not some random occurrence, but an indication of nerve damage due to high blood sugar levels, a condition called diabetic neuropathy. Diabetic neuropathy can manifest in various ways, but it commonly starts in the feet. You might feel a tingling sensation, like 1,000 tiny pins prickling your skin, or it could be a sharp, jabbing pain that takes you by surprise. Some people describe it as a burning or throbbing sensation, while others might feel extreme sensitivity to touch, where even the weight of a sheet can be unbearable. But it's not all about pain. Diabetic neuropathy might also lead to a loss of sensation. This means you could injure your foot and not even realize it because you don't feel any pain. It's a dangerous situation, as unnoticed injuries can lead to serious infections. Now you might be wondering, why the feet? Why not the hands or other parts of the body? Well, the damage often starts in the longest nerves, the ones that reach to your feet. As the condition progresses, symptoms might also appear in the hands and other parts of the body. The good news is, early recognition of these strange sensations can lead to early diagnosis and treatment. This can help manage the symptoms and prevent further nerve damage. Regular foot checks should be a part of your routine health checkups, especially if you're experiencing these sensations. Remember, diabetes is a condition that doesn't suddenly appear overnight. It gives signs. It signals its arrival. And strange sensations in the feet are one of these signals. It's your body's way of raising the alarm, warning you that something is amiss. So the next time you feel an unexplained tingling, numbness, or pain in your feet, don't brush it off as just fatigue or the result of standing too long. Don't ignore these sensations. They might be trying to tell you something. The fourth sign takes us to our senses, specifically hearing and vision. Diabetes, a condition often associated with blood sugar levels, can indeed impact our senses in ways you might not expect. It's a bit like a stealthy intruder, slowly and subtly affecting your body. Let's start with hearing. High blood sugar levels can cause damage to the small blood vessels in the inner ear, similar to how it can affect the eyes and the feet. This damage can lead to a condition called sensorineural hearing loss, a type of hearing impairment where sound can enter the ear, but the brain struggles to process it. The change is often gradual, making it easy to miss until it becomes significant. Now, let's turn to vision. High blood sugar levels can affect the tiny blood vessels in the retina, the back part of your eye. This condition, known as diabetic retinopathy, can cause blurry vision, floaters, and even vision loss. Like with hearing, the changes are often gradual, and one might not notice them until the damage is already significant. It's crucial to understand that these changes are not a normal part of aging. They are symptoms of a systemic issue, and they require attention. Regular checkups with your healthcare provider are essential to catch these changes early. Regular eye and hearing tests can help detect these issues before they progress to a point where they significantly impact your quality of life. It's also important to remember that managing diabetes effectively can help prevent these complications. A balanced diet, regular exercise, and proper medication can go a long way in keeping your blood sugar levels in check and protecting your senses. If you notice any changes in your hearing or vision, it's time to see a doctor. They can help you understand what's happening and guide you on the right path to manage your condition. After all, our senses are our windows to the world. Let's do our best to keep them clear and sharp. Love taking long naps? It could be more than just a love for sleep. Yes, you heard it right. Taking long naps might be a sign of a health condition you wouldn't necessarily associate with sleep, diabetes. Now let's delve into the science behind this. Diabetes, a condition marked by high blood sugar levels, can mess with the body's energy regulation. When the sugar in your bloodstream isn't efficiently absorbed into your cells due to a lack of insulin or insulin resistance, your body doesn't have the fuel it needs to function optimally. This can lead to feelings of fatigue, prompting you to take more naps than usual. Furthermore, the body's natural response to high blood sugar levels is to try to flush out the excess sugar through urine. This, in turn, can lead to frequent trips to the bathroom, even during the night, interrupting your sleep cycle. The result? You guessed it. You feel tired and sleepy during the day, leading to those long naps. It's important to note that napping per se isn't a bad thing. In fact, power naps can boost productivity and alertness. However, if you're finding yourself needing long naps regularly or feeling excessively tired despite getting a good night's sleep, it could be a sign of high blood sugar levels. But remember, it's not all doom and gloom. If you're experiencing these symptoms, it's vital to consult with a healthcare professional. They can guide you on the right path to control your blood sugar levels and improve your overall health and energy levels. Also keep in mind that these symptoms are not unique to diabetes. They could be signs of other health issues as well. So it's important to seek medical advice and not jump to conclusions based on symptoms alone. Remember, excessive sleep or fatigue is not always due to stress or a busy schedule. It could be your body's way of signaling that something is off balance. So listen to your body, seek medical advice, and take steps to ensure you're living your healthiest life. Now that we know the signs, let's discuss a natural and homemade way to manage diabetes. One of the most effective strategies to combat diabetes is weight loss. When we shed those extra pounds, we're not just slimming down for aesthetic reasons. We're also reducing the amount of fat in our bodies, which in turn helps to improve the function of our liver and pancreas. Why is this important, you might ask? Well, our pancreas is a key player in insulin production, and insulin is the hormone that keeps our blood sugar levels in check. An efficient pancreas means more insulin, and more insulin means glucose can be more easily transported from our blood into our cells, where it's needed for energy. Moreover, losing weight can increase our body's sensitivity to insulin. This means that the insulin we do have can do its job more effectively, again helping to maintain those all-important blood sugar levels. However, weight loss is not a silver bullet, nor is it a quick fix. It requires a balanced diet and regular physical exercise. And while this might sound daunting, remember that small changes can make a big difference. Swapping out sugary drinks for water, going for a brisk walk after meals, or taking the stairs instead of the elevator are all simple ways to get started. In addition to weight loss, there are also some plants that can help control blood sugar levels. Certain types of plants contain compounds that can enhance the effects of insulin. For instance, bitter melon, cinnamon, and fenugreek are all known to have blood sugar-lowering properties. However, these should not be used as a substitute for regular medical care, but rather as a supplement to an overall healthy lifestyle. If you're already on medication for diabetes, it's crucial to talk to your doctor before incorporating these plants into your diet. Some plants may interact with your medication, causing blood sugar levels to drop too low, which can be dangerous. To sum it all up, weight loss, achieved through a balanced diet and regular exercise, is a powerful tool in managing diabetes. Incorporating certain plants into your diet can also be beneficial, but always remember to consult with your healthcare provider first. Remember, it's always important to consult with your doctor before starting any new regimen. We've covered a lot of ground today, from understanding the significance of inflamed or infected gums, to recognizing the ominous dark spots on the neck. We've explored some of the early signs of diabetes. We've also delved into the strange sensations in the feet, hearing or vision loss, and the need for long naps that can all indicate this silent disease. Remember, early detection is key. It empowers you to take proactive measures towards your health. We've discussed the effectiveness of natural and homemade treatments, primarily weight loss, in controlling blood sugar levels. A balanced diet, regular physical exercise, and certain plants can do wonders in managing this condition. But always remember, if you're on diabetes medication, consult your doctor before using any plants or herbal remedies. Take control of your health, stay vigilant, stay healthy,